Welcome, everybody. Welcome. Wish you all had a good lunch. So welcome, everybody, to this first ever public health panel at Oxford China Forum. And a big welcome to the audience joining us via live streams in China and other parts in the world. My name is Xi LIU, the panel director. I'm working on the panel together with my colleague, Zhejiang. Let me introduce the theme for you. China has been striving for better health for all its population, or as the forum theme goes, for all its 1.4 billion heartbeats. There have been so many achievements and challenges that we don't even look, all the way back into the history to find some examples. Let's just look at the past year. Spring is the season for a change for better, so we saw this institutional reform in the government with the new agency of National Health Commission, among many others. And in summer, I went to the hit movie Dying to Survive, as many of you did. And I was told by my friends that I should, bring a pack of tissue, but no one told me to bring 2 packs at least. So at that moment, I really wanted to see the director who made me running out my tissue. And thanks to OCF this morning, we had the chance to meet the director, Wen Muye. But not everything was, as inspiring as the institutional reform or as the movie Dying to Survive. In July, we saw substandard vaccines for children went into the market, and this had broke the heart of hundreds of thousands of parents. Towards the end of the year, a Chinese scientist, He Jiankui, claimed that he had genetically edited twin babies to prevent them from having HIV in the future. This was indeed a cold wind blow to the entire scientific community. What do the hot issues tell us about the achievements and challenges in public health in China? The panel is really in good hands to address this issue today. Please allow me to present our distinguished panelists. We start from your right. We have Professor Minchin. I apologize if you can't find the profile in your booklet, but I guarantee you that you can find Professor Chen's profile in Oxford website as well as the forum website, because Professor Chen is just with us in Oxford. He works at the Oxford University's Nuffield Department of Population Health. He's the director of the China programs at the university's Clinical Trial Service Unit and Epidemiological Studies Unit, and also the co-executive director of the China Oxford Center for International Health Research. Second, we have Professor Fujie XU. Her public health career is primarily at the Center for Disease Control and Prevention at the US government, where she was an Epidemic Intelligence Service officer. Then she worked for 3 years at Gilead, a biopharmaceutical company, as the Director of Medical Affairs and Public Health in Asia and the Pacific region. After 20 years of public health practice, she finally came back to China, joined Zhejiang University in 2017 through the National Talent Recruitment Program. In the middle, we see another lady, Dr. Helena Wong. She is the Asia Executive Editor of the Lancet. She is primarily responsible for setting up the journal's development strategy in China and more broadly in the Asian region. She is also responsible for attracting and reviewing submissions, thousands of submissions every day, and organizing the Lancet commissions and many distinguished conferences. Dr. Wang herself has also published widely in editorials, comments, and world reports. Please allow me to present to you Professor Yuanli LIU. He is currently the Dean of Chinese Academy of Medical Sciences and of School of Public Health at Peking Union Medical College. He also serves as the president of the Chinese Aging Well Association. When he worked at Harvard, he was a founding director of Harvard China Health Initiative. In the past 2 decades, Professor Liu has closely involved in healthcare reforms as a government policy advisor. Without further ado, please join me to welcome our panelists and start a great discussion. Well, I guess the short introduction was never enough. So please, can you take a little bit more time to briefly talk about yourself to give us some flavor of your work, please?
Want me to start? Okay.
Yeah, sure.
My name is Zhengming Chen. I'm a professor of epidemiology at the Nuffield Department of Population Health. I started my school in 1967, so I grew up during the Cultural Revolution. So it was a very chaotic time period, very wild. I learned very little from school. But equally, I was not touched by endless examinations as your generation has suffered. Despite that, I managed to get to the university in 1978 when China decided, Cultural Revolution started to open up again. So I went to the Shanghai Medical University. I think one of the best medical schools in China, but not now after merging with the Fudan University, which is a pity. So after graduation from medical school, I was enrolled into postgraduate training in public health. 1987, I met, purely coincidentally, Sir Professor Richard Peter, which is a giant in our field, during a coffee break international conference, which led me to Oxford, initially for a year, but after over 30 years, I'm still here. I think much of my research concerning with prevention, treatment of non-communicable chronic disease, such as cancer, diabetes, and cardiovascular disease. I don't treat patients myself, but my research is mainly to generate large-scale, reliable evidence that can inform guidelines, that can inform policy development. The reason is because when I first arrived in Oxford, my first tutorial by professor was 95% of population, world population are American, 99% are not British, and 90% of the disease in China, many other countries, are chronic non-communicable disease, such as cancer. So when we do research, we should keep in mind, big pictures, think big, think internationally, and take chronic disease very seriously. So over the last 30 years, I've been involved in setting up a very large-scale studies, hospital-based randomized controlled trials of a treatment for heart disease, stroke, cancer, as well as a very large-scale observational studies. My most recent study, which has been going on for 10 years, but will continue for the next 30 years, is called China Kadoorie Biobank. Again, it's a large collaboration between Oxford and Chinese Academy of Medical Science and Peking University, which try to understand, evaluate the main determinants of a chronic disease: lifestyle, diet, physical activity, environment, as well as genetic as well. We have published a lot of the papers, but a lot more to come. Our next big paper will be published shortly in the Lancet concerning the health effect of alcohol, especially on the cardiovascular disease. I think we'll have a huge policy impact as well. So I'm stopped here. Thank you very much.
Okay, good afternoon. My name is Fujie XU, and I have been known as a Fujie, so with a silent E, for almost more than 20 years. Glad to be here, really, and I thank the panel. There's a first, you said, public health panel, right?
Public health panel.
So public health is not always under the spotlight. So I really want to thank you also to be part of this activity. So my background, I went to Beijing Medical University when I started, and 10 years after Dr. Chen. But the university was swallowed by Beijing University. So I guess we got to upgrade, so it's okay. So after that, I went to the US to get my PhD in epidemiology, but I also pursued the clinical side. So I work at a Centers for Disease Control and Prevention. It's a federal agency for public health as a medical officer. And up to 2015, then I take another turn and work for a pharmaceutical company called Gilead Sciences, which is specialized in antiviral treatment. The last job I have is with the Zhejiang University. All my career is pretty much in Atlanta, which is known as the capital of public health, because we have CDC, we have a Carter Center, and we have American Society for Cancer, and the kind of very important institutions for public health. And then after moving to China, I picked Hangzhou. It's actually probably many of you don't know, but it's actually the capital of infectious diseases in China. They have a long history. So I just about a year ago settled in Hangzhou. So I want to, for those of you who are thinking about what you do, you can see I have been, with one degree, I kind of work in different agencies, federal government, pharmaceutical company, and now academic. So you don't care where you start, just, how some of you are going to jump in to be friends of public health, or better yet, join us as a public health practitioner. So I'll stop there.
Hello, everyone. I'm Helena Wong, the Asia Executive Editor of the Lancet. It's a great pleasure for me to be here to discuss with you the progress and the problems that China public health system confronted. As I heard from the organizer, this is actually the first public health session. So I actually think it's the perfect timing for us to be here to talk about the challenges ahead. For my personal experiences, I think before I joined the Lancet since 2010. So before then, the Lancet only has 2 offices located in London and New York. Why they opened an Asian office in Beijing? That's because the Lancet realized the huge research potential of China, because the amount of China's submission only next to UK and US, ranked 3rd in the world. So the Lancet think, okay, we should go to China. We should know, because China is the future, means the future of the research. It's the research power station. So I'm very lucky and privileged to view the China's progress by a unique lens, the Lancet. So during the last almost 10 years, my major roles like a bridge, building connections from Chinese researchers and the Lancet. To my Lancet colleagues, I always tell them what kind of the China background, why this paper must be considered by the Lancet. Because they're based in London, they basically want to know more about China, but they knew all about China from media, from BBC, from CNN, but not from real person. So I'm very lucky to tell them the real story here. But for the Chinese researchers, I'm trying to tell them what kind of papers the Lancet is looking for. So I'm very happy to be here to share the stories I have experienced to view the both sides in the last decades. And also in my spare time, I enjoy traveling and reading books and also movie. Sorry to miss the movie session this morning. And I'm a mother of 2 girls. Thank you.
Good afternoon, everyone. I want to start out by thanking the dedicated student organizers, such as Lilly Tu, behind this great event. You are really the unsung heroes. Now, 2013 was a very important year for me. That year, I decided to leave Harvard University, where I worked for 20-some odd years, first as a postdoc research fellow, then as a faculty member in the area of global health, to return full-time to China, to do 3 full-time jobs under 1 salary. My salaried job is to serve as a founding dean of the School of Public Health at the Chinese Academy of Medical Sciences and Peking Union Medical College. So in response to China's 3 major transitions in the health sector, the aging population, rising non-communicable diseases, and disability transition, where mental health and long-term pain has become disabling factors in addition to traditional diseases. My school has established 5 major departments to engage in applied research studies and also educate future public health talents for China. The Department of Biostatistics and Epidemiology, where Professor Zheng and Professor Xu specialized in. And then we have a Department of Occupational and Environmental Health, Then we have Department of Nutrition, Food and Drug Sciences. We have a Department of Behavioral Sciences and Health Communication. And last but not least, the Department of Health Policy and Management. So the faculty of 5 departments, together with our graduate students, we have been conducting impactful research studies. And the 2 cohorts of our graduate students already graduated from the new School of Public Health, and they are playing important roles in policy making, in the healthcare practice, as well as the health industries. Now, I have 2 unsalaried full-time jobs. The first one is serving as a policy advisor to the government, and the second is to work as a social advocate. A particular role is serving as the president of National Association for the Elderly Care. And when I became the new national president of this association, I changed the name to Aging Well. So I look forward to the interactions with the very informed audience with you today.
That's perfect. So we have a large profile of expertise in different diseases like NCD, infectious disease, cancers, and we also have this expertise from very different sectors. Let's talk about the March institutional reform first. It's massive and could impact public health in many ways. Can you help us, better understand the impact by giving examples from your work or your research, please?
I think you mentioned, during the 2018, there's been some major government reform and restructuring, and affecting in the health sectors. I think, for example, the establishment of the State Drug Administration, as well as the State Administration for Health Insurance or Medical Security, and also formation of called the National Health Commission. But I think this is all the existing sort of government commissions or ministries. But I think it's some sort of fundamental changes. The one thing is try to streamline the government activity, try to deliver much better health. For example, with the State Drug Administration used to be, 20 years ago when I started to do large-scale trials in China, it used to be part of a small division within the Ministry of Health, and then become independent, but also responsible for food. But this time they dropped food, focusing primarily on the drug, which is actually quite appropriate, emphasize the need to regulate the drug approval, the research as well. And the same is true for the health medical security or health insurance. It used to be partly under the Ministry of Health, partly within the Ministry of Finance, etc. It's scattered around, but now they try to bring together. I think it's wonderful, and it will definitely deliver much better, efficient health care. But I think one of the most important reform, in my view, is Ministry of Health or National Health Commission. The 2 things: one, they drop family planning. It used to be called Ministry of Health, and then 2013, and they changed it to National Commission for Health and Family Planning. But this time, rightly, very correctly, they dropped the family planning. We should come to that issues as well. I mean, another thing which is very less well known is now they take huge responsibility for tobacco control, because China, many years ago, signed a treaty, international treaty called Framework Convention for Tobacco Control, which is a very important treaty. But it was managed across different departments with very little progress over the last few decades, 10, 15 years. And now, all the major responsibility now with the Ministry of Health. I think it's the right move, but there'll be huge challenges as well. We should come discuss that as well.
I'd like to put healthcare reform into perspectives. First point I'd like to share with you is that I believe healthcare reform is and will be always work in progress. Worldwide, it's not just China which is doing healthcare reform. Every country is doing some kind of version of healthcare reform. No matter what concrete measures, we share 3 common objectives. I summarize them in AAA aims. First, all the reforms is about increasing availability of the health services people would need. Second, to enhance affordability of those services once they become available. Third is to make sure that the services we provide are appropriate, are proper, okay? So over the past 40 years, ever since China embarked on the economic reform and opening policies, China has undergone 3 distinguished phases of healthcare reform, with each phase targeting as one of the AAA aims. For the first 20 years, from 1970s to 2000, the 20 years, the major aim of the reform is to increase availability of the healthcare services. Because when China opened its door to the outside world, we all of a sudden find that we don't have so many services available the modern medicine has to offer. So the government, which does not itself has money, encourage all the healthcare facilities to try and find ways to make money themselves so they can buy modern equipment and more drugs. In short order, the total healthcare size from 1980 to 2000 increased from 20 billion to more than 450 billion RMB. So over the course of 20 years, the healthcare expenditure in China has been basically increased 24-fold. And that's more than 100% increase rate per year, okay? So the availability of the first phase is increased very dramatically. But that success resulted in the escalation of the medical costs, especially the out-of-pocket expenditure of the Chinese families as a percentage of total healthcare expenditure increased from 20% in the 1980 to more than 60% by 2000. So the second phase of China's healthcare reform is targeted at a medical impoverishment by expanding healthcare insurance and by controlling healthcare expenditure. Now, by last account, China's second phase reform has been a success. More than 95% of Chinese people nowadays are covered by some kind of healthcare insurance schemes, okay? And the out-of-pocket expenditure decreased from 60% nowadays to 30%, okay? So China is entering the third phase of healthcare reform. That is what is China's healthcare reform policies aiming at now, is to promote the kind of value-based medicine, okay? Balancing, controlling costs, and assuring quality. So that's where we're at today.
Thank you.
Sorry, just want to echo Professor Zhengming's comment just now about the new functions of the National Health Commission. Talking back to the new new National Health Commission, I actually wrote an editorial published in the Lancet last year. I think there were 2 new functions of National Health Commission worth mentioning here. The first, as the Professor Zhengming mentioned, National Health Commission is responsible for the WHO Framework Convention on Tobacco Control. This is really a great progress. Actually, Professor Zhengming and the Oxford group published a paper in the Lancet in 2015 saying that without wide cessation of smoking, the deaths caused by tobacco use will increase from 1 million from 2010 to 2 million in 2030 to 3 million in 2050. So it's a great problem. So I think I should applaud for this kind of progress. The other thing I would also mention, the new function, is that another great public health problem, aging. So now the aging community was fully integrated in National Health Commission. Before, the national aging community was leading the national efforts to tackling aging society. So as we all know, China has a huge burden of non-communicable diseases, and tobacco use and aging is the leading risk factors. So I think the new National Health Commission shows the restructure of the government body, shows a strong signal that China is transitioning from hospital-centered disease treatment model to disease prevention, and public health promotion. So that's why also prove that our session today is so important.
But Professor Xu, you've got rich experience from 3 sectors.
I want to give, I agree with everybody has said. I just wanted to add 2 examples. One is back in 2003, when SARS was raging in Beijing. I was sent to Beijing to help to control SARS. One of the reasons you may not imagine is that patients, especially patients from the rural area, they cannot afford hospital care. So they're running around from one hospital to another hospital and rejected. In the way they transmit SARS, for you don't remember, that was a long time ago. So SARS, when you're symptomatic, is a respiratory transmission. So that was one reason. And then during the response, there was a change that for if it's a SARS patient or suspected to have SARS, and the government said you don't need to pay for the hospital care. That really dramatically changed the quarantine and the isolation of patients. And that was, for now, with this change in 2018, one of the changes combined the rural the financing part for the rural population and the urban population. I mean, it's obvious, the virus doesn't care you're from the rural area or you're from the urban area. So that was one thing, and with the free care and the patient becomes symptomatic. The change in the later part of the response was that the isolated within like 1 day, the median time was like 2 days. So that really cut the transmission dramatically. And before I left Beijing in July, SARS was contained. That was kind of almost unbelievable because when I was signed to Beijing, as back in the CDC and in the US, we were kind of prepared mentally, saying that's going to be, we should be getting there for the long haul. But China did this, very good response. I mean, everybody now are free from SARS now. We don't need to worry about an endemic disease. Another example is, with this new policy that Dr. Liu mentioned, there's a lot. We have to think about hospital is not only for care. From public health background, we want to think about how to prevent the diseases, pneumonia, whatever. But do you know, like in China, if you, the pneumococcal vaccine, that is very important for children and elderly, it's not free to this day. So it's kind of, they call it a second, in a different category, basically still self-pay. And so, I don't know how many countries, China is, is a quite rich country, but it's uneven, but this kind of vaccines is not available for the people from the poorer part of China is kind of still a struggle right now. So I would think it, smoking cessation, vaccination, that's kind of something that China should really take a hard look and think about how to make a healthcare more value-based instead of charge as when you get sick, go to hospital, then getting the care later when you get sick.
I noticed.
I want to add is that there is a national basic public health program which has been in place for the past 10 years. And that now covers altogether 45 major public health services, including some basic vaccination services for the children, and not the extensive list of vaccinations, some basic vaccinations, yeah. And the package of the public health services, which are provided free of charge to everyone in China, is in the process of being updated. So hopefully next year, some of the important new vaccinations will be included.
I hope so. Another thing I want to add is from the drug side, is that for the HPV vaccine, it took like more than 10 years to getting after the product become available in the UK and in the US. It took more than 10 years for China actually approve it. Even though it's on the private market, people pay for it. They still take the FDA, they used to be the old called CFDA for so long. But the good news is that that's for the initial products, but now for the updated newer HPV vaccines, last year there was a record, I think it's like only 2 weeks or something for the new, after the reform. They don't require the company to do trials in China anymore, so they can make an approval much faster. It's like we're talking about weeks or days even, not years. So that's the improvements for sure.
Right. Speaking of vaccines, would you please help us unpack this black box of vaccine production? How did it go, from lab work to the injections we see from clinics? What's the processes of vaccine research and manufacturing?
Vaccine, actually, there's a lot of issues with the vaccine R&D and A. So let's look at the R&D for research and development. I think when we look at the landscape of vaccine development, it's getting better, but it's really not a lot of activity. I think it's lagging behind. The reason is complicated, and one of the reasons is that for example, the free vaccines, the government pay very little, like the profit margin is very little for the pharmaceutical company to actually develop something better. So it's kind of stuck there for a long time. So the R&D is not a lot of investment into it because they feel like may not getting what their revenue back. For the application, it's another major issue. I mentioned the pneumococcal vaccine as an example, and the HPV vaccine is another good example. You can imagine that infectious diseases actually, for the people who are poor or less able to afford the vaccine, they are more likely to be affected actually by infectious diseases. I look at it closely for the HPV vaccine, the human papillomavirus vaccine, which is the cervical cancer vaccine, by the way. The people who die from cervical cancer in China, women die from cervical cancers, are more likely from the underdeveloped area. You know why? Because in developed area, there has been a secondary prevention, which is a screening for cervical cancer, early lesions for cervical cancer. So people don't progress to later stage of cancer and die from it. But those screening programs, services are less available or less affordable in the less developed area. Nationwide, the percentage is still very low. But in a province like I came from Zhejiang province, which is the richest province per capita in China, the cervical cancer screening has been free and has been in a public health service program for many years. So people much less likely to die from cervical cancer. But this is the area when people getting their injections for the vaccine. So you see that this match between who getting the vaccine and who actually getting the disease in China. It's an odd, so the social impact of the new products, the vaccine products, can be much improved in China if they have a national kind of policy. That's Professor Liu's job to make it, advise the government to think of this, how to make the, value and including the equity part of use of, even though for the newer, the vaccine, which is not that cheap. The free vaccines are the ones for measles and those kind of things are very cheap vaccines, but the new vaccines are much more expensive.
That's all very, very good examples to help us better understanding the research and manufacturing processes. So in the vaccine scandal last year, which link did it go wrong?
I want to comment that because, I'm a mom of 2 girls, and my younger one was only 2 years old, and we have been vaccinated regularly. So as parent, we are very nervous. But to be honest with you, I think the major problem I can see is the public confidence in the vaccine at that moment. I followed the vaccine report in social media, and I found vaccine was the problematic vaccine. The major problem is that problematic vaccine was described as the poisonous or directly causing children's deaths. So at that time, there was a huge mass misunderstanding of vaccine. So actually, I have full confidence in China's vaccination program because China's public health program was owing to the vaccine, owing to the national immunization system. For example, the traumatic decrease of HBV infection is because of hepatitis B vaccination. So actually, I would insist the children to get vaccinated. And I think the thing is that we have to let the public understand why vaccine is very necessary. And why those children have social problem is not because of vaccine, maybe. So also, I think it's important for the government to understand, to be transparent, understand why the public is so nervous. And also, there's a responsibility for the media to interpret the story in an appropriate way.
I have some.
Yeah, can
Yes,
I add?
please go ahead.
I think it's very important to enhance the public awareness of the importance of vaccination. But as Dr. Xu earlier pointed out, a very important issue, we do have a problem with the supply side. You see, actually to provide effective coverage of vaccination requires a cold chain and the quality assurance program, which is not cheap. However, currently the government's financing policy has not kept up with the cost increase. And in the market economy today, many suppliers, the manufacturers, the providers, they would have to cut corners, and then that behavior, of course, adversely affected the quality of the vaccination. And so the recent scandal of the vaccination from Shandong and and Changsheng, right, really cost the SFDA head a job, and a bunch of government officials got fired. But I think the strengthened regulation of the quality of the vaccination is important. But probably more important is how the costs can be adequately covered so that the suppliers and the manufacturers and the providers would have a financial incentive, to provide the vaccinations to the people, to the children they really need.
I want to add that this is a very important area, and as a parent, I can imagine, when they realize the children getting the vaccine that it may not be safe, their concern is tremendous. There's many issues, but also I wanted the audience to put things in perspective. In China, the size of the birth cohort each year is like 17 million. So that's like, I don't know how many babies are born in UK. The 17 million is a large number. And when we have some, so there's thousands of clinics doing vaccination in China. In the US, we know it's like for administrative errors, it's about 600 errors being reported. And so you look at every, I don't want to discount the troubles, or the emotional, burden to the parents, but I also wanted people to think about, for a program of such size, some problems is almost unavoidable to happen. When problem happens, China right now, I think that they are more likely, thinking about punish someone instead of look at the root cause. One of the root causes, is the cost of the vaccine has been kind of artificially suppressed to the level that it cut to the minimum or to the bones that the company is struggling to try to, make put the product on the market and then try to make a profit. They are a business, so they need to have a healthy, what is called profit margin. But that's not being addressed. I think that's one of the, and obviously they don't make a profit out of it. They don't have a expectation to make money out of it, so they don't invest in the R&D part. And also, whenever there's issues, it's kind of become viral on the internet, and there's a lot of point fingers. And then there's another thing is people lost their jobs. I don't know. Personally, I don't think that's the reaction. I would think there should be more rational decision making. Look at it. All the problems. Root causes instead of treating the symptoms and punishing people, especially people in the public health side. I want to speak for my colleagues at the CDC side, and they really did the best they can. They have been they have been working long hours. If you look at it compared to the U.S., which is I'm now more familiar, the pediatricians are kind of natural allies for the public health side. They explain the value of vaccine. They interact with the parents and children. And in China, there's a kind of almost in the own silos for the vaccination program. So there's not a lot of social support necessarily or understanding about vaccine. How we can get there, I'm not sure. Your policy side, you can think about. The last thing I want to add is that we are hopefully going to address this issue. There's accumulation of all the anxiety, the erosion of confidence about vaccine. So many people are trying to put their heads together. And last week, 2 weeks ago, we were thinking to put a white paper together for China vaccination programs. So we're going to look at the supply issues. We're going to look at R&D, issues, and we're going to look at some of the, management issues. Also the supporting the program from, the grassroots level and up.
Professor Chen, in your view, what should be done or could be done to prevent this kind of scandal from happening again?
I think this topic has been very well covered. I agree entirely with as the panelists described. We need to not get the symptom, but get to the root of the problem. I think not rush to make decision to punish. You need to actually investigate very thoroughly across different levels. From the top government to the management to the factory to the specific individuals, because we're dealing massive challenges. Trying to vaccinate 70 million, 80 million newborn babies, and each year. It's a huge challenge. I think it's you cannot avoid this kind of risk. Absolutely, something bound to happen. But what we need to learn is from try to find out what's really going on, try to develop new procedures, and try to strengthen the delivery. Coming back to another question regarding the vaccination development, the question you raised, and it's also relevant for the cancer therapies, which is a topic covered this morning's movie, Dying to Survive. I think this has been a very, very expensive process. If you look at all the novel treatment drugs, I've been involved last 20 years in also trying to evaluate some kind of treatment. It's a very, very long, slow, expensive process. For each drug to bring that to the market, to the patient, and it now costs about almost $2 billion and 15, 20 years of development work. So it's very, very expensive. I think, China need to invest. At the moment, a lot of drugs actually imported. That's why they are more expensive. But also, in terms of the delivery of a drug to the patients, there are a lot of system costs within China, which are much less so in places such as UK, Europe, not necessarily in America, because the UK is a very socialist sort of, healthcare delivery, which is free, which is very important. I think government should, take very seriously. In the UK, there's a called NICE, which is called National Institute for Clinical Research Excellency, which evaluate and decide which drug should be incorporated into the healthcare delivery free. I think we need to see similar mechanism, systematic, every year, each time evaluate the systematic, try to bring the best treatment to the patient. At the moment, it's a lot of things happen haphazardly. Something happened, some sort of media coverage, and then government trying to do things. Instead of a proactive, it's very much reactive to the problem.
I'm very happy that
When it comes to effectively dealing with infectious diseases, I want to add 2 important points. One, for vaccine preventable infectious diseases, of course, vaccination is very important technology innovation. And this innovation not only benefits children, but all age groups, right? For example, flu vaccination would benefit also disproportionately the elderly. But I also want to add another point, that is the public health intervention is not just technology intervention, but in many non-vaccine preventable infectious diseases, social intervention, behavioral intervention are a very important option. For example, we all know that HIV/AIDS is a sexually transmitted, or mainly sexually transmitted diseases. And the world over is working very hard to put that disease epidemic, AIDS epidemic, under control. And China has been successful for the past 20-some years to put this epidemic, the prevalence rate of HIV is, below 2%, below 2%. However, for a particular age group, the elderly group, the prevalence rate of HIV is actually alarmingly on the rise, and twofold increase over the past 5 years only, And you may wonder, why is that the case? You see, when the elderly people, when they become retired, now they have money, they have time, and besides dancing in the square, right? And they are also was solicited or attracted by the sexual workers. So that's the new kind of challenge. And China and other countries has to come, to terms with, and where behavioral interventions are more important than the technical ones.
Thank you. I wish to press the topic of cancer drugs Professor Chen mentioned earlier. Why are cancer drugs priced so high? Can we talk more about that?
Everybody probably, I don't know whether you heard this 200 million rule. Usually for a new drug from lab to the market will take about 10 years, to develop, and will cost over about, $1 billion US. About, So it's very, very expensive to have a new drug developed. Therefore, the patent protection is very important. And for the companies who develop the new drugs, effective cancer-fighting drugs, they need to have some kind of mechanism to recuperate their costs. Therefore, the initial price of cancer drugs and other drugs are very high, and where social and commercial insurance coverage becomes necessary, because if you ask the individual to pay, many patients cannot afford, to pay for it. But there are 2 ways of dealing with this problem. One is, of course, increase insurance coverage, but the other one is to promote generic drugs. And that's, the multinational organizations and also countries like India and China are very much in the process of doing that.
Just come back to that one. I think the issues highlighted in the movie, I think it's not universal. It's also happened time to time in countries such as UK. when for some rare conditions there's no cure, suddenly there's a modern novel treatment, but very, very expensive, especially when condition is not very common. And there's always media coverage, very sensational, why government, could not cover that one. I think it's a real challenge, a dilemma, because in terms of public finance, you just got pot money. You want to make sure it's spent most cost effectively. So you cannot sort of provide free of care for everything. This is absolutely impossible, even in states, most developed countries. So I think in the UK, there's a very good way. I think, China start to look into very seriously, I mentioned briefly, which is called evidence approach. A government organization called NICE, National Institute for Clinical Excellency, who evaluate not just the efficacy, effectiveness of the treatment, but also cost effectiveness as well. I mean, if to save one life, it costs per GPT per capita, and then they will consider it to be cost effective, and then they will add into the, otherwise, so this is actually the entry point. I think that's actually quite effective ways doing that. I mean, the problem in China is one thing, there's a lot of treatment not available. On the other hand, there's a huge problem with unnecessary treatment, over-treatment. For example, this is a historical issue. 20 years ago, with SFDA, 1 year they approved over 20,000 drugs, over 20,000. It's a complete mess. So now if you go to China, even doctors don't know what this drug do. Everything, they treat everything. And because fee-for-service hospital, although it's a public hospital, they're not covered. Government only cover 5-10% of running cost. Hospital has to run, to make money. How to make money? They charge, they overprescribe, they give this kind of treatment, this kind of treatment. I think there's a huge issue. So if the money, government money, individual sort of money can be spent much more effectively, efficiently, I think, a lot of things can be covered. At the moment, there a lot need to be done as well.
Yeah, I want to say, it's kind of a typical situation. We said, everybody want a coverage for their treatment, but not many people want to pay taxes. So you can see people getting lawyers and, sensational stories about not being not able to access to treatment, but not many people kind of standing in the street corner ask their taxes to be increased. At least I haven't seen many of those. So this government have to balance, the ins and out, obviously, for the drug cost, particularly for the cancer treatment. Some of the treatment, as you know, is really individualized treatment. So they're definitely going to be expensive. And the universal health coverage, I think in China now, per capita, per year is about 480 yuan. I think that's like less than how many pounds, and like 50. So it's really not, they cannot really cover a lot of cancer treatment for sure. But fortunately, China with the economic development, one thing I think it should be considered is private insurance. And that can be put a buffer when people, private insurance is, health insurance means that many people pay into the pool and only few people getting, and within the period of 1 year, only a few people are going to need that cancer treatment. So that can be one way to protect the high cost from cancer. It's, many, I work for, I think at the beginning I mentioned that for the Gilead Sciences, they have a program specifically called the Access Program. This is for hepatitis C drugs. That's hepatitis C drug, when they develop, is very expensive. So expensive that it's, so each pill costs $1,000 in the U.S. But in the countries I work in, the Asia Pacific region, the company give us discount in the low-income countries. It's like 99% discount. So so that's like the treatment can be as low as like $300 for the cure of hepatitis C. That's like compared to like over $90,000 in the US. This is really, but the good thing for this kind of discount is possible because it's small molecule. So the manufacture cost for the hepatitis C antivirals is very cheap. So the company can getting pretty much their R&D money out of the development market, so they can give the discounted price to developing countries. But for cancer treatment, many of the treatments by definition are individualized treatment, and they are going to be expensive just for the manufacture. Not only the R&D, is making those large molecules is expensive. So I'm not sure there's going to be, what is called a economy of scale. You're using large numbers, you're going to lower the cost. I'm not sure for cancer that's going to be the formula. So it's just very different because the R&D cost and the manufacture cost.
Actually, I want to raise another point because China's, according to my observation, China's why cancer drug is so expensive is because Chinese patients rely a lot on imported cancer drugs. Actually, I remember the data show that half of the cost or on the imported cancer drugs. So actually last year, Chinese government vowed to exempt the tariff of the cancer drugs to try to reduce the drug pricing. So the government really realized the problem. They tried to do something. But actually, however, I want to also emphasize, instead of importing more new medicines from developed world, from US or UK, the decision should come within China. So actually, it is perfect time for the Chinese drug industry to collaborate with academia to find a solution, to find drugs for Chinese patients.
I want to sidetrack the discussion a little bit. So far, the attention has been overly focused on wonder drugs and treatment and cure. I think we would miss the big picture of prevention. The bad news is when it comes to cancer, cardiovascular, and other non-communicable diseases, the situations will become worse before becoming better, because many of those problems are caused by environmental and lifestyle changes. But the good news is, if over 80% of those problems are caused by environmental pollution and unhealthy lifestyles, they are preventable, okay? So my team has recently conducted the epidemiological studies of the stroke in China, which is the largest killer, of the cardiovascular diseases in China. And we found that the environmental factors and the salt intake and oil intake, lack of exercise, and all those simple things, if we change, we modify, will significantly reduce future incidence of cancer and cardiovascular diseases. But we have done very little in that regard.
You mentioned some risk factors for cancer. It's more like external factors, right? Do we have any insights about the internal factors?
I'm very glad Professor Liu mentioned the prevention first. I think we have to understand the epidemiology of cancer and many other disease. I think the current picture is not that so bleak. There's a really positive achievement, even for cancer. I don't know whether some of you watch a sort of a video clip by Jack Ma, which I watched many years ago, gone very wide. I mean, he also concerned about cancer epidemic in China. In his speech, he mentioned three things. He said, lung cancer is rising, liver cancer is rising, stomach cancer is rising. For lung cancer, it's air pollution, ambient or outdoor air pollution. Liver cancer because of water pollution. Stomach cancer is food, poor food, hygiene, etc. I think as epidemiologists, I spent many, many decades researching these questions. Unfortunately, all three conclusions are totally wrong. I'm still trying to find opportunity to meet with him, try to communicate, discuss. I have a great respect of Ma Yun, Alibaba, but I think in terms of health, this is a very specialized area. If you don't get right, you get message across misperception. For liver cancer, within 20, 30 years, we can totally eradicate liver cancer in China. Because in China, liver cancer is driven primarily by HPV. Now we have universal HPV vaccination, universal. Another thing is aflatoxin, which is a moldy food in peanuts, in corn, in some things. Used to be very common because you don't have a refrigerator. Now it's almost gone. So in Qidong, one of the areas of done research with the very highest liver cancer rate, among those who aged 20 to 30, we see 8-fold reduction in liver cancer deaths, 8-fold, even before the introduction of HPV vaccination. So this is definitely, I'm very, very confident to make that kind of prediction. With the stomach cancer, it's not poor hygiene food, it's a bug, which we call H. pylori. I hope after this, many of you will go to see doctor if you don't feel comfortable with the tummy. You may be infected. 60%, 70% got the infection. Very simple treatment. 2 weeks, antibiotics, amoxicillin or omeprazole, very effective. And then, mission accomplished. With the lung cancer, yes, it's rising. Now it's the #1 cancer in China, still rising. I don't think it's much to do with air pollution. I think it's entirely with the smoking. No one talks about smoking. Among Chinese women, among those who don't smoke, we see very significant reduction in lung cancer rates. I'm not saying air pollution is not important. It's very important. But in terms of a cause of a cancer, many other diseases, smoking is by far the most important things. And 1 million deaths now from tobacco, 2 million by 2030, 3 million. I mean, the first generation we will see the worst affected will be those who were born 1970s, 80s. I mean, still early stage, we still got time. I want to see Chinese government take that very, very seriously. There's a very effective measures, tax rise and the packaging warning. Two things I don't think it's been done takes very, very seriously.
Yes, I just want to add 2 new messages about tobacco. Because last year, the Lancet published 2 papers on tobacco in China. First, from Professor Chen Wang, the president of Chinese Academy of Medical Sciences. He found that COPD is a chronic pulmonary disease. It's a huge burden in China. So why COPD is such a huge burden? It's related to smoking. And in the end of last year, the Lancet Respiratory Medicine published another paper from China on worrying trend of adolescents. It shows that adolescent smoking rate is increasing. So that adolescent health becoming more and more important in China. So it means the future of China, they still use the tobacco control. Tobacco control is not that effective as adolescent. So I just want to emphasize that part, and tobacco control should be the first priority at the moment for the public health.
Okay, so we covered many different kinds of diseases and many different kinds of risk factors. Now I want to touch upon something more mysterious about our genes. Now genetic research is really a buzzword in the science area, and many experiments have been done on animals. How do you view the issue at the end of last year about the human genetic editing?
I think with the genetic, this is a really fast-moving field. 10 years ago, 15 years ago, to sequence one gene cost $3 billion. 300 scientists and 13 years just crack one gene. And now the cost is coming down to about a couple of $100 within a couple of hours. I think with this kind of genetic research, will greatly transform our understanding about disease, biology, disease etiology. Will also help us develop new drugs as well. I think this is a very, very exciting area in the 21st century. We're doing a lot of things like that. But I think when you come to genetic research, you have to separate a couple of things. One is just understanding the genetic determinants of disease by measuring people and the link to their lifestyle to the disease. You're not trying to manipulate genes. But when you try to come to do like stem cell or gene editing, I mean, the main question is not the technology, it's actually ethical issues, moral issues, ethical issues. I think with that, we come up with this kind of scandal, and there has been a lot of coverage as well. I mean, this is the issues have been discussed about 10 years ago. There are a lot of declarations how this kind of research should be conducted, monitored, managed as well. So this is, I think, we still need to come back, remind people there's a, consent issues, there's ethical issues, how we're going to deliver bad science to gain the trust of ordinary people as well. But overall, my concern is, China, other places, because of this kind of scandal for ordinary people, they don't really see, what's really going on. They blame, they blame everyone. They blame this kind of research. I mean, similar happened with, many years ago, we call golden rice scandal, which is a GM food. Again, it's really pity. And now, GM food, especially golden rice, is formally recommended for places like, in developing countries to try to improve nutrition, vitamin intake. But its issues caused such outcry at the time. It's not because of science, it's because communication, it's because of media, it's because lack of this kind of a dialogue between scientists, public, government, and then the decision make, the concluded.
Uncertainty.
Uncertainty as well.
I would say gene editing is an important advancement, and as other technologies that can do good and can be, bad associated with it. So the key to that is a regulation. I think for this, event, it's an unfortunate event. It should not happen. I think we should make it clear. The treatment should be on the individual level. So for genetic disease, that you can, for treatment, but I think the consensus right now is pretty clear. You don't want to make the genetic changes to individuals that gene change will be, inherited to the future generations. So in other words, you don't want to perpetuate the change, but for individual level change, this is acceptable for genetic diseases. That's okay. Because when you die, you're with it. That change is ended. But for the human gene pool, there are so many uncertainties with the gene editing right now. We don't want to make the changes at this stage that it can be perpetuated in the future. It's a lot, we should protect, and especially some of the enhancement for this particular case is not really medically necessary. It's really making this, quote-unquote, this babies resistant to HIV infection. But you know that even at the individual level, the risk associated with this change is not justifiable by the medical benefits, which is really, HIV is preventable right now. And if just in case you get it, it's a treatable disease and not a fatal disease anymore. So on the individual level, I think it's still, on the population level, we don't want this change that happens that can be, put this change gene into the gene pool for the future generations. And even at the individual level, it's not justifiable because the benefits, the risk, and risk and benefits, the ratio is not there for this to make it justifiable. And also there's a process. There's another third level of problem with this particular event, is that as I mentioned, it should be regulated, it should be ethically reviewed. But just a lot of kind of mysteries or what happened, we don't know for sure. And for how this research, quote-unquote research, was allowed to happen. So it's many layers of, at the process level, at the individual level, risk and benefit ratio level for the individuals, and also the genetic editing for the perpetuation for the gene pool. It's a pretty clear consensus. We don't want to do that, but so this one, I mean, it's a disgrace. It should not happen.
Actually, I think last year the gene-edited babies case was a very special case. It was actually, in my opinion, it's a very unethical human experiment which is unlikely to bring any real beneficial effects to the recipients, but also put the patients in a real danger, in a potentially danger and unknown risks. So I think we have regulations there. So the Lancet public editorial on that case, we already have regulations here. It's just people doing the experiment. He just ignored the sort of regulations. Also, after that event, I remember we published 3 letters from Chinese government as well as Chinese researchers which condemn this kind of research. Also, we think now we couldn't change anything. The baby was born and we have to protect those babies. But we can do something. I think the reaction of the scientific community, also the public, is quite important to decide the future path. Because our reaction, this kind of case, this very special case, can set an example for the future. Whether we'll determine the path, whether we will advance the progress towards safety and effective treatment, or whether it will delay any innovation and innovation in science. So I think this case actually also showed broken the contract between the science and the community, because the community assume the scientists do the research for the benefit for the society, not ruin the society. So actually I'm very angry at that case at that moment.
No, well said, I agree.
Okay, thank you. I suppose the genetic editing thing is not, exclusive to China, but it's a challenge or threat to the entire world, right? Is there one day that possibly genetic editing on human is allowed or become ethical in medical practice? Is there the day that we can expect?
Just because we can, technology will be advancing, that's for sure. That's going to, but just because we can do it is not because just because we can do it is not means we will do it or we should do it. I think Helena mentioned it very well. It's for this kind of thing. I don't know the researchers putting the babies or the family first, or his own fame or gain at first. That's pretty obvious. I mean, that's why you're angry, because as a scientist, they can do things, but this is not. You have to balance the risk and the benefits, and not. I think this, from many levels, and this case is just very bad. It's very bad, but good thing is something good. If you want to look at a silver lining out of this, is that I currently have a project funded by Chinese government. Within 2 weeks, I think we were asked to put a statements on, and everyone have to, with the Chinese government funding, have to put statements whether they are doing anything similar. So basically, first of all, they're going to report those, and also make sure you don't do this in the future. So that, I think something I would say we can put this behind, not only facing this as an unfortunate event, but also kind of put the awareness and making better enforcement. So hopefully this kind of thing will not happen again.
I think just very briefly, and also we have to look beyond. These kind of issues will surface again, and are not necessarily gene editing, but in some other field. I think this is inevitable as technology develops. We're also facing new challenges, new ethical issues. We need this kind of dialogue, discussion involving not only scientists but also with government, with general public. I mean, another thing is probably that hasn't really caused much attention, a little bit. And it's actually another case surfaced recently using malaria to treat cancer. It also raised serious ethical issues as well. But I think, unfortunately, there's been very little discussion. I mean, it's less controversy because for gene editing, definitely crossed the red line. But with the malaria, there's also issues, with a human experiment, development drug, there's a very, very standard procedures. Do no harm. You have to do a lot of things before you can subject to the patients. Even patients desperately need. But this does not mean you should do that. I think with this kind of malaria treatment, we know it's definitely harmful. That's why we have Xi LIU with the Nobel Prize with Chen Haosu, to treat malaria. But why you want to give them malaria? It's no passaging to treat there's no solid scientific evidence. That's speculation. You need a lot more work before you can subject patient to this kind of treatment. But surprisingly, there was very little discussion, and then media just talk about for a few days and suddenly disappeared. Mm-hmm. I mean, that's really pity, because for this kind of non-political issues, I think that we need to see a lot more discussion, open discussion, like this kind of forum, across board in China. I think that's very important, partly to get general consensus, partly to educate ourselves, educate the public. I mean, this is very important. Otherwise, the trust will be lost. We'll have a huge damage for scientists to be able to do this kind of very beneficial, worthwhile research for the health of the next generation.
Excuse me, I just want to echo his point, because I think another reason is because the scientific world is very competitive. Everybody wants to be the first. So everybody is under a lot of publishing pressure. So, in the Lancet, we get a lot of a lot of submissions from China saying, especially young doctors, young researchers, they have a lot of pressures, publishing pressure. So for the gene-edited case or the malaria curing cancer, I think it's just the scientists were under a lot of pressure. And also this kind of culture that they want to be in the spotlight and they want to be the first.
I don't think the benefits could actually, for the individual researcher, should be used as a justification. No matter what kind of pressure and he or she under, it's not, I mean, just like a company don't want to break the law to make money. You don't want to break a law to make yourself career successful. That's just common. I mean, just I think that's what is called a 底线, or some,
Bottom line.
It's just very unfortunate for this kind of thing to happen. I don't want to go as far as a culture or a pressure. I think it's a lot of research in China. I know there's young people trying to establish their career. I mean, this everywhere. It's not only in China.
One last comment on this.
I do think Helena raised a very important research ethic issue. This is a China forum. We want to tell the world our success stories, but we also should, at least spend a moment to do some self-reflection and self-criticism, what we have done not so well. I think on one hand, yes, I think Helena can eyewitness a remarkable growth of contributions of research papers by the Chinese researchers. But also, I think the gene editing fiasco is not an isolated incident. It's an indication of a widespread unethical behaviors on the part of many, many Chinese researchers, doctoring the data, right? And that problem is reflected in a large-scale retracking of many research papers, not just from Lancet and other magazines. I think it's also it's a challenge, but we need to turn that challenge into opportunities to vastly remind ourselves, to vastly enhance the ethical standards beginning with the Chinese researchers.
Great. On the way to health for all, we saw all those kind of challenges like ethical problems, cancer drugs, vaccine safety, and chronic diseases. But on the brighter side, we see that the health system is moving towards, as Professor Liu mentioned, like 3A, affordability, availability, and appropriateness. I see that the future is bright, and importantly, we have all those kind of self-reflections from different sectors. That's very important to the future development. Now, maybe it's time to open the discussion to the floor and take some questions. Yes, please.
Thank you very much. Thank you for this really fascinating panel discussion. I'm a PhD candidate studying the health reform in China here at Oxford. I think a lot of the discussion just now have been focused on the affordability and the cost control. We knew that the government has initiated the reform towards reducing the medical composition of the cost, and on the other hand, increase the medical service fees. Can anyone brief us how has this kind of reform, to what degree has it contributed to cost control, and what is the impact on the medical professionals' remuneration? Has that sort of reform, how does that incentivize them?
Maybe we also take the question from the gentleman there on the right.
Hi, Professor. Thanks for sharing. My name is San Chuan and a postdoc from Cambridge. I have two questions. The first one is one belt, one road bring a lot of challenges in economics, but it also bring a lot of challenges in our public health. So can you talk something about the one belt and one road and our public health in the way of communicable disease? And my second question is that the media in China play an important role in the publicity of the medical reform in China. So can you also talk something the challenges that we meet in the way of media? Okay, thank you.
Can you understand?
Can you clarify your second question, please?
What's your first question?
那我可以说
It's global health, one
So the first question is about One Belt, One Road, right?
我可以说中文吧。那个我的英语口语不是很好。就是我们在那个“一带一路”的时候，给我们经济带来了很多机会，但是对我们的公共卫生也带来了很多挑战，特别是传染病这一块儿。就是各位教授能不能对这一点进行一个说明？还有另外一块呢，就是说关于媒体在我们大陆卫生改革这一块呢，也扮演了一个很重要的角色。对，在这一块的我们的挑战和和达到的成就，各位教授呢也能不能也说一点这两个问题？好，谢谢。
Maybe let me react to the question about cost control. Yeah, definitely one of the major objectives of the recent healthcare reform initiatives targeted at bringing the costs in line. And two indicators of some kind of a success of that measure. One, the growth rate of healthcare expenditure is reduced very much. And recently my team has done a structural analysis. For the past 8 to 10 years, the total healthcare expenditure increase is largely explained by the increasing of volume of the ambulatory and hospital utilizations rather than by per unit costs, okay? And that, of course, and another indication is the drug expenditure, not only in total volume, but also as percentage of total healthcare expenditure is also remarkably decreased. Not long ago, the major sources of revenue for the hospitals and many doctors in China coming from the drug prescription and dispensing, right? Now the government forcefully enforced the zero profit policy, preventing healthcare providers from making any money from dispensing drugs, and that definitely has an impact on the drug expenditure side. But on the other hand, we know that every service, medical service, has a cost, right? And so you reduce some costs, that means reduced revenue and income for the healthcare providers. So that needs to be rebalanced by increasing the traditionally underpriced services. So many local governments are in the process of doing that, particularly Beijing municipal government. And so far, that has some positive effect. But the doctors in China, generally speaking, are chronically overworked and underpaid.
No, go ahead.
I just want to comment two parts. The first question is about healthcare reform. Because you know the Lancet published published annual China Thinking issues. So before 2008, in 2008, before the healthcare reform initially started, the Lancet published China Thinking issue. So in a 5-year of ceremony of healthcare reform, we published an independent evaluation of China's on track of the healthcare reform. And this year we will publish another issue to celebrate the 10th anniversary of China's healthcare reform. So I'm very lucky to join the process and view the great progress in different areas like primary health care, increasing the basic health services to the citizens. So in 2012, when we celebrate the 5-year healthcare reform, we published a paper from Ministry of Health showing that the coverage, China already achieved universal health coverage. But the problem is, I think the quality. The major problem is the quality now. So we have offered services, but how we can ensure we get good quality service to the Chinese patients. I also want to comment on another question about China's role in global health. Because in one of our China issues, as a Lancet editor, I first cried before when I read a paper about China's role in global health. Because that paper written from Peking University showing that in the last few decades, China changed from a recipient of global fund to a donor in the world. So it's a huge change. So now I think it's the perfect time for China, when we talk about Belt and Road, it sounds like it's maybe, we talk about a lot about economy purpose or economy strategy. But I think the health is another key for the Belt and Road strategy. And also China should have a global health strategy to be more active, because we have actively involved in Africa, in many other countries. We have done that already, but we need a coordinated efforts. And also I know that in Chinese university, they already started a Global Health Institute. So it's a perfect time for China to take the role and have a coordinated efforts in global health.
Very briefly, I think that one of the fundamental issues for healthcare reform in China is health service a commodity? And whether we should adopt free market mechanism. I personally have been living in the UK. I don't think so. I don't think this is the way forward. I don't think with that kind of a trajectory path, we would be able to deliver, universal health care very cost effectively. I mean, you all live in the UK for some time period of time. You can't really go to hospital. You have to go through a GP. GP is as a gatekeeper. 85% of minor conditions, you don't need to go to hospital. But if now go to China, it's like free market, like, that supermarket. Anyone pop in, they can see doctors here, there. And that's why for the real health problems, they only got 1 minute, 2 minutes. I have a lot of friends working in hospital. Every day they see 120 patients a day, 120 patients. It's absolutely impossible. They don't even look at you. They say, okay, test, go to lab, do this test, do this test. It's not serious. We can't, this kind of system cannot function. Luckily, China now start to look other examples, like primary health care. That's the future. If we don't do the very fundamental changes, I don't think, hospital-based, kind of a health delivery will be able to deliver what we want. I think that's a fundamental. It doesn't matter whether you increase, reduce reimbursement, the drugs there. If you don't have this kind of a regulation, manage the process, it's consumed like you go to restaurant, buy things. Healthcare, health issues, it's very, professional issues. You need doctors' guidance. I think if you don't manage that process, I think it's going to be impossible, in my views.
I want to put in one comment about the global health part, and China is benefited greatly from globalization, and for infectious disease, you mentioned the infectious disease. For those of you sitting in the audience, you don't get infectious disease, or your risk of infectious disease is low because the people around you have a low risk of infection. So like tuberculosis, for example, if you have people around you have TB, then your risk of TB is higher. And in China, is so intertwined with the global community. They have to deal with infectious disease in particular. But I think we are still in the very early phase of engaging in that. It's taking a very important steps, but it's a baby steps. Last time I heard from China CDC, the budget for global health was like 800 million RMB. That's like a little over one. It's like, but like the budget is small, and also there are regulations. They cannot making grants. They cannot make grants to CBOs, community-based organizations. China cannot do global health for the world, so they have to partner with something like a community-based organization. We did that for HIV, for example. Then you have to in the country. But because of China right now, it cannot give money to the community organizations and other things. What they can do right now is still limited.
Maybe I'll say the forehand there. That's always been that.
Thank you for the impressive and inspiring discussion. I'm a DPhil student in Oxford. I'm looking for my career in technology investment. So I'm very interested in the topic of the drug development. I have two questions. The first one is that if there is an innovation company looking forward to develop a new medicine, is there any disadvantage or advantage at CFDA as compared with the American counterparts, FDA, or the European counterparts? And also, among these organizations, is there potential cooperations that might minimize the repeating work of those companies and improve the overall welfare of the humankind? Thank you.
Okay, I mean, very good question. I think this is something we're doing now. One of the major challenges with the drug development is not manufacture drug molecule. It's the pathways, the target, the mechanism, the mechanism. Very often you've got drug very, very effective. You can block, you inhibit, has no effect on the disease risk at all because you capture the wrong guy. So I think now there's a major development over the last few years is to use the genetic. It's not gene editing. It's kind of a loss of function. Some people carry particular changes in the gene, which changes the proteins, your metabolism, disease pathways. And then you can do very simple analysis, try to target specific whether this is actually the major potential drug target. And then you can develop. I mean, there has been some really exciting drug development very rapidly, very cost effectively. Just recently, we have formed a major collaboration with the Chinese farmers. We got, 25 million pounds to do this kind of research. Our aim is trying to use this kind of modern approaches, try to identify target, and then you can develop drugs, and that can be, marketed very, very cost effectively. I think this is a very exciting area. I mean, all the big companies are doing that.
In terms of the China-specific, advantages, China has many things that may not be as good as, R&D capacity is still low, for example. But in terms of look at it, the positive side, I want to make it two things. One is the number of patients, for like liver cancer or, lung cancer, the patient volume for trials. If you have to do the phase 3 trial, for example, The patient volume is definitely because of population size and the disease burden is much easier. Another thing is the Chinese government making this a leading industry for the future. And where I come from, in Hangzhou, they have this kind of building hub for R&Ds for new drugs. There's like 200 or even more companies, many of them startups. So the government gives them a lot of incentive in terms of policy, tax policies and all that. And also they try to make another problem with is like linkage between the R&D of the company need, but the hospital have to help partner. So the Chinese also trying to build a network of nationwide they call it a clinical research center. In the past, they have been investing heavily in the basic research. So you have people doing like biology, or people have doing something like a structural biology. That's kind of called a science in China, a basic science. Now it's a clinical science is catching up. So those are two positive sides I think are important trends that you should pay attention to. Good luck with the investment.
For someone who wants to play a role in the R&D space, I have both bad news and good news for you. Yeah. The bad news is that ever since the former head of SFDA was sentenced to death, right, for approving too fast, too many new drugs, now majority of the reviewers and regulators are on the more cautious side, right? Nobody wants to make a mistake. Now, but the good news is that China is already, put innovation at the top of the new economic development model, and promoting health industry is one of the 5 major strategies of a Healthy China 2030. The drafting process I had the honor to get closely involved in. So the government and the regulators, as well as Ministry of Health and Science Technology, will very much, in my view, in the future, encourage joint ventures of the R&D global company and the U.S. And the China domestic companies, yeah, rather than supporting one or versus the other.
I'm afraid we have to close the session today. Sorry to all those disappointed fans. You've got future opportunities, especially questions addressed to Professor Chen, who is based in Oxford with us. So thank you today, Professor Liu, Dr. Wang, Professor Xu, Professor Chen.我们先退场，然后观众再退。啊，您给我吧。